Today we're going to finish the notes. We'll talk about inflammation and tissue repair and how tissues change when aging. And that will finish up the chapter. So our test will probably be on Wednesday. Okay. I'll take that. So inflammation is a response to tissue damage, and it's an immune response, and it causes redness, heat, swelling, pain, disturbance of function. And these all these manifestations are kind of to help prevent you from using that tissue again so that it can repair itself. So that you notice that something's wrong and you either don't use it or you protect it or some sort in order to help the body heal that tissue. When there is an injury of some sort, the mediator is released from the tissue surrounding the injury, and those include histamines, kinins, prostaglandins, and leukotrienes. And what these chemicals or hormones do, they stimulate pain receptors, and they increase the blood vessel permeability, as well as movement of white blood cells to the affected area. So what it does is help dilate the blood vessels. What does dilate mean? When you think of your pupil, if it dilates, what does it do? It gets bigger, right? So you're dilating your blood vessels. The blood vessels get bigger. Lets more blood get to that area. The blood is transferring all kinds of white blood cells and the immune response cells that will help prevent infection in that area. So it dilates the blood vessels. And then also increases the blood vessel permeability, meaning that the white blood vessels or whatever compounds, whatever chemicals are being transferred through the bloodstream, they're able to get out of the blood vessels easier to that infected area, wherever it needs to go. There's also edema, which is swelling that occurs when water, proteins, and other substances from the blood move into the tissue to help repair and fight infection. Neutrophils are the white blood cells that phagocytize the bacteria introduced, and they die after ingesting the bacteria and kill the bacteria with it. Then macrophages ingest the tissue debris, and they can continue. They just kind of like digest it in themselves, and then they can go on and keep living. Neutrophils die. And then when you have an infection or if you have an injury and you have pus that forms there, the pus is an accumulation of dead neutrophils, other cells, and fluid that are in there. So pus is a good thing. It means that your body's fighting off the infection. We probably need to get rid of the pus. So if this is a picture of our injury, and they're using a splinter in this case, so a splinter in the skin causes damage and introduces bacteria. That releases the mediators of inflammation, and that would be like your histamines, kinins, proteoglycans, those are prostaglandins, leukotrienes. They are released and activated the injured tissues and the blood vessels, so then some blood vessels are ruptured, increases blood flow to that area. That's what produces the heat and redness there. They cause the capillaries to dilate, causing the skin to become red, and they also increase the capillary permeability, and fluid is able to leave the capillaries, producing swelling. Then white blood cells come into the area. They leave the dilated blood vessels, move into the site of bacterial infection where they begin to phagocytize bacteria and other debris. So they start ingesting lots of the foreign particles. So after we have that immune response to the infected area, we have to repair the tissue that's been injured. So the tissue repair is the substitution of dead or damaged cells by viable or functional cells. And you can have regeneration or replacement. So regeneration is when you replace the cells with functional cells that can carry out the same function. If you replace a cell, you replace it with connective tissue, and you're going to lose some of the function of that tissue, whatever it is. And cells are classified based on the type of cell they are. Liable cells, they're capable of mitosis throughout the life. So they're always dividing and having cell mitosis all the way through their life. They don't ever stop growing and dividing. And so skin, mucous membranes, hemopoietic tissue, and lymphatic tissues are examples. Stable cells, when they grow to their mature state, they don't continue having mitosis occur. But once there's injury to that tissue, then it can start mitosis again and help regenerate that tissue. So like the liver, pancreas, and endocrine cells are examples of that. And then permanent cells, if that cell is killed, it's going to be replaced by a different type of cell. It can't regenerate itself at all. The nervous tissues, skeletal, and cardiac tissues are examples. Now, nervous tissue, like a neuron, if you have a neuron and just a part of it is damaged, like just the axon, it can develop a new axon and replace that axon or dendrite. But if major damage occurs to the cell body itself of the neuron, then that neuron will die and be replaced. So that's kind of what happens if you have a spinal cord injury. Why they can't regenerate that. They're just replaced by connective tissue, and then the neurons can't communicate with each other, and then you lose function of the whatever part of your body wherever it's injured. Skin repair, the couple different terms used with that. Primary union is if you have a cut and the edges of the wound are already close together. So a lot of times, like if you have just a slice through your finger, if you cut yourself with a knife or something, and then the edges are already close together. The wound will fill with blood, and then a clot forms. And the clot has fibrin in it, and those fibrin threads start to contract, and they are what pull the edges of the wound together. And then a scab forms, that clot. And then the inflammatory response occurs, and that's where you get the pus underneath the scab as white cells die. There's granulation tissue that replaces the clot, which is delicate connective tissue composed of fibroblasts, collagen fibers, and capillaries. So, like if once the scab falls off and you have kind of really pink skin underneath of that, it's really delicate. It's new skin. It's the granulation tissue there. And then a scar is formed from the granulation tissues, where the tissue turns from red to white as capillaries are forced out, and then you are left with the scar. Never turned white? No. I don't know. Most will. How old is it?
Almost 2 years.
Oh. It should be done, repairing, in 2 years. A secondary union is when the edge of the wounds are not very close, so there's greater chance of infection where it's a gaping wound, like a puncture wound maybe, or if you have a tear. And in that case, the clot, because there's going to be a lot of bleeding there still, but the clot may not be able to close the gap in between the edges of the wound. So that's why if you have a big gash or a big tear or something, yeah, you go to the doctor, get stitches. That brings the edges of the wound closer together and allows your body to heal that tissue. The inflammatory response is greater. You have a lot more foreign particles being able to be introduced into that tissue. And wound contraction occurs, which leads to greater scarring. It's just because they can't pull the edges of the wound together, so you get the greater scars. Sometimes even if you have surgery and you have a scar, if it gets kind of pulled open again, the incision or whatever, or it gets infected, then you can get a bigger scar. I've seen some people have had knee surgeries, and instead of having a nice little scar, they have a big worm-looking scar because it got infected or something happened there. So. Oh. So here is a wound. the fresh wound, so this is our sliver again, I think. This is the same picture, and they've taken the sliver out now. But there's fresh wound cuts through the epithelium, the epidermis, and the dermis. So then there's a clot that forms from the blood that's in there. And about 1 week after the injury, the scab is present. And the epithelium or new epidermis is growing into the wound. So you see how the epidermis is growing here. And now next chapter we'll learn about more of the epidermis and dermis. But we have the epidermis go deep into this cut where normally this would just be dermis, but it's going to replace itself. The scab, the clot is pulling the edges of the wound together. So it continues to growing from the deep out to the bottom. This is your granulation tissue. About 2 weeks after the injury, it says the epithelium has grown completely into the wound and fibroblasts have formed granulation tissue. And then about 1 month after the injury, the wound has completely healed, the scab has been sloughed or it's fallen off, and the granulation tissue is being replaced by new connective tissue. So this would still be a little bit red looking, and then as the granulation tissue is replaced, then it becomes the scar. And the last part of this chapter is on how aging affects tissues. So as you age, cells divide more slowly. So if you do have an injury to a tissue of some sort, it's going to heal a lot slower. Because it heals slower, there's a lot greater chance of infection. So the elderly need to usually have some sort of care taken with a cut. Not minor cuts, but if they cut themselves with a knife or something, cooking or something. Collagen fibers become more irregular in structure, though they may increase in number, which makes the tendons and ligaments less flexible and more fragile. So if they fall and they fall on their shoulder, you see a lot of rotator cuff tears there. Elastic fiber fragments bind to calcium ions and they become less elastic. So arterial walls and elastic ligaments become less elastic. So you see, my med-term students, what is the hardening of arteries? Yes, you see arterial sclerosis. Yep. The changes in collagen and elastin result in atherosclerosis and reduced blood supply to tissues, wrinkling of the skin. Remember, the skin has a lot of collagen and elastin in it, so you start to see lots of wrinkles when the changes in collagen and elastin. And then there's an increased tendency for bones to break. Bones become more brittle. Then the rate of blood cell synthesis declines in the elderly, so injuries don't heal as rapidly either. And talk about that. And I believe that's it. So you can work on your chapter your chapter packet. The packet is due at the end of the period tomorrow, along with. Actually, at the beginning of the period, I'd like to have you have 2 test questions with answers. If you want to do that right now and get that done with, you sure can. You can hand it in to me today if you want. Otherwise, tomorrow is fine. We'll go through your questions that you write out on Monday. Tuesday, we'll play a game, and then Wednesday will be your test.